Hello, this is Dr. Marzban from CSC Clinic. I hope you have a wonderful day. This video will talk about whiplash symptoms and diagnosis, and this is our interest to make these videos for educational purpose for the students, clinicians, as well as for the patients, that they have better understanding what is going on. And we have seen many patients that have had the whiplash injuries with different symptoms and signs. And for example, for past few weeks, we had a patient that was in car accident 2 years ago, and there were 4 cars involved with that accident, and his car was the third one, and his car was hit several times during the accident. And since then he got treatments, different therapies, and he was diagnosed for brain injury, and they did a MRI, and MRI does not show much, and he got the x-ray of the neck and the back, which were the original complaints. And so he has the memory issues, has the issues with the doing the daily job, taking care of his employees, and young man, smart guy, and but cannot concentrate, has hard time to read. His relationship with his girlfriend is not optimum. It could be better. And his dad is very concerned about his health, and he sees the changes in him that is not normal. And the other case is the middle man age who was in soccer game, and he was goalie, and he got hit by the opponent, and the opponent's knee got landed on his head, and he lost his consciousness for 5 minutes, and now he has headaches, lack of concentration, some emotional changes, and cannot do his job, and he's tired all the time. And beside that brain injury, we have a patient that has the scleroderma and also Raynaud disease, and she has issues in the hands. The fingers get purple, bluish, white, depending on the time, and so that is again autonomic issues, and that she is presenting. And the other one is the middle-aged lady that she got hit by a car, and she was a pedestrian, and she landed on her side, and now she's suffering with the pain that comes from the neck, supraclavicular, that goes to her right hand. Her right hand is always cold, and again is the vasculature, possibly autonomic nervous system is involved with that, and she has improvements in her neck and lower back, and the frequency of getting her right hand cold has improved, but this is another scenario that would be something that a clinician should be more significantly look into it, and differentiate between the peripheral and central lesions. I hope that this video would be beneficial to you, and if you have any questions, again, let us know. We are always trying to improve ourselves, and helping each other is the goal. And enjoy it. Hello everybody, I hope you have a wonderful day. We're going to be talking about the whiplash, and my name is Dr. Marzban. I'm a DC, Doctor of Chiropractic. I have a PhD in human anatomy and specialized in neuroscience. I hope you will join me and enjoy the presentation. The paper that we're going to be referring to today, the title is Central Pain Due to Injury of the Spinal Thalamic Tract, which was misdiagnosed as complex regional pain syndrome. It is a case report, and we're going to be talking about the differences between central and peripheral pain. We're going to talk about the different tracts, including the spinal thalamic tract, and we're going to be describing what the complex regional pain syndrome is. These are the name of the authors. The source is Diagnostics, and the publication happened on October 2019, which is very recent. Mayo Clinic talks about different causes of whiplash on their website. I'm going to take you to their website. Here's the Mayo Clinic. That's the address. Whiplash. They talk about the overview, symptoms, causes, complications, and they have more information related to whiplash on the website. We'll refer to those references as we go on, and we discuss what they mean and how we can use that information in our clinic to do a better diagnosis, as well as how we can treat the patients with different scenarios. Mayo Clinic mentioned about the cause of whiplash. The one that they have on top of their list is auto accidents. And they said that rear end collisions are a major cause of whiplash. And we agree with them. That's what we see as well in our clinic when the patients come to seek for the treatments when they get into the car accidents. Usually there are rear end collisions, and but not necessarily that the people they get hit from their sides or the corners of the cars. They have less symptomatic issues than the rear end collisions patients. And also, we have to keep that in mind that if someone is rear-ended, means that someone hit to their back. So the people they hit the cars in the front of them, they also have whiplash, similarly to the people they got rear-ended. But unfortunately, they do not pursue medical care or any type of treatments for the symptoms that they suffer. And most of the time, the cause of that is that they don't have money to pursue the treatments, and they would be at fault, and the insurance companies, they do not cover their medical expenses. So they don't go and find a place, a clinic, to get the treatments for what they suffer. Physical abuses and assaults are also not uncommon, and but unfortunately may not be reported as often for many different reasons. And people, young ladies, as well as elderly people, possibly children, that they cannot protect themselves and defend themselves physically, they get abused and have some type of whiplash during the trauma. Contact sports also part of the cause of whiplash. Again, football, rugby, hockey, those are all very heavy physical sports, and many players get hit and get whiplash and shooting pain that travel to their arms, legs, as well as going to their hands. And but again, we have had cases that they were not in uh, professional sports, but in recreational type of activities, in sports, they get hit, and again, they don't pursue uh, medical care and physical care, and the reason is that they're kind of expensive to be treated, and it is a long-term process, and they don't do that. And well, if somebody is in the professional sports, they have all the money to get the care for it, and therefore they have a better chance of recovery. But regular people that they don't have that luxury, usually they will have a long-term suffering. I need to add that my children were in different types of physical sports, and including football, wrestling, and one of them was in rugby team, and all of them, one way or another, they got injured and get some type of trauma in different parts of the body, knees, head, neck, elbows, shoulders, back. But also, it is needed to be mentioned that even the sports like soccer or baseball that felt that they are not as dangerous, possibly, as the ones that we mentioned earlier. We have seen people that they were in soccer team and they started playing soccer at the early age. Over time, hitting the ball with their head, those are mini whiplashes that over time it will become accumulated and the patients will suffer later time. Mayo Clinic talks about different symptoms which are commonly associated with the whiplash. Neck pain and stiffness, almost always seen with the whiplash patients. And the neck pain could be either due to the soft tissue or hard tissue damage, and the stiffness could be because of the pain associated with the movements as well as the muscle spasm that is trying to protect the area from further damage. Then patient is going to feel worse during the movement, and doing the detailed examination with that, it can help the clinician to know and what to do with the further testing, and which direction the patient feels more pain, and what type of pain the patient feels. Is the musculature, is it more a disc associated with the pain, or any other type of pain that the patient can feel with the movements. And sometimes it is because of the irritation to the nerve itself. And due to those pain and discomfort, patient is going to be either guarding. Again, that's another uh, sign that the clinician is trying to see if the patient is guarding or not guarding, and what is the range of motion that the patient has, and is it associated with the pain or not pain, and how much pain it is associated with that motion, and the direction of the motion. All of those are very important findings in the first or second day of uh, visitation. But again, in our practice, these measurements almost always taken every visit to see that what the progress of the treatment is. There are different types of headaches associated with the whiplash, and some of them are vasculature, some of them are referral, some of them are autonomic, some of those are the brain shock, some of them are meningeal, and there are different types of headaches that the patient can have, and and then later time with the chronic case, stress headache is very common among the patients. Again, the headache can be at different areas of the head, and knowing where they are, and is it dull, or is it the shooting pain, is it pulsating pain? All of those are the very major findings in the office to have a better understanding what the problem is with the patient. Patient is going to feel pain and tenderness in the shoulder, upper back, and arms, possibly to the fingers. And again, that could be because of the referred pain, or it could be because of the nerve damage. And again, um, we don't we also have to consider the central nervous system damage, like a spinal cord, the brain, and the brainstem. Even though it is in the cervical uh, area that the patient feels that the damage occurred during the accident, but the central lesion can cause the pain travel all the way down to the lower extremities as well. So we don't have to narrow down our examination to the neck only. So higher and lower area of the body also have to be examined by the doctor to have a better idea what is the extent of the damage during the accident. Tingling and numbness in the arms as well as the lower extremities, face should be tested, and patient can experience those as well. Patient, they're going to feel tired, and especially as it gets longer to get the results, and that tiredness, it affects the mental power as well. Dizziness is also one of the common symptoms among the whiplash patients, and that dizziness could be either vasculature, or it could be because of the nerve damage, or is due to the upper cervical misalignment and muscular dysfunction, or as well could be either the brain damage itself, because there are areas in the brain that deals with the understanding and sensation of the where you are in the space, and damage to those areas can cause the dizziness as well, and or dizziness could be associated with the direct damage to the vestibulocochlear system. Blurred vision also can be seen as a symptom in the patients, and that could be again associated with the vasculature, autonomic brain, associated with the visual pathway, and sometimes even patients, they're going to express themselves as having blurred vision when they have double vision, not being able to focus visually. Ringing in the ears is also a common symptoms, and that could be either vasculature, again autonomic, or upper cervical, as well as the damage to the vestibulocochlear system. With all said, patient is going to feel pain and being fatigued, and all the symptoms that we just talked about, with the lack of the motion, pain with the motion, they can disturb sleep, and therefore patient is going to suffer from a good quality of sleep most of the time. And that is one of the questions that the clinician should ask the patient: what is the quality of sleep? And again, if the patient, after several visitations, they feel that the sleep is better and they have better quality of sleep, that's a very good sign to the office that the treatment plan is the right plan. Patients they feel become irritable very easily, either physically or mentally. And again, this comes with the pain and chronic fatigability, and those are all bring the limbic system to the threshold to express much easier to any type of stimuli comes, and that stimuli could be either physically or emotionally associated. Patients that have a hard time to focus, readings, uh, even completing the form in your office, and not being able to do well in at a school, or not functioning well in the office because they are tired or they are fatigued. They cannot concentrate. They cannot follow the steps and the protocol. That is part of the symptoms that the patient can suffer. Memory problems, it comes with it. If it happens in acute case, that is not a good thing as well, because mainly it refers to more of the central and brain damage. If it is during the chronic case, with the irritability, become fatigued easily, lack of sleep, and not being able to concentrate, eventually is going to affect the memory of the patient. Depression can be seen in the chronic case most of the time, and therefore it is something that a clinician should always look into how the patient is presenting in the office, and hopefully uh, that feeling of happiness comes after a few visits and treatments, and rather than having some feeling down and hopeless. Mayo Clinic talks about the different type of diagnosis, and their examinations can be done at the office, again, to see that what is the range of motion in the neck and the shoulders, if the shoulders are directly affected or being affected due to the neck damage, and doing the uh, uh, correct examination on the range of motion, and writing down the degrees of the motion that the patient feels restriction or restriction with pain would be very helpful later time to see that what the prognosis is and what is the progress of the treatment is. Patient feels the pain in the neck and shoulder, how much they feel, where do they feel it, what type of pain, tenderness they feel it. And again, if it is a centrally damage, then you also have to look into the lower extremities. Complete examination includes doing the uh, careful examination on reflexes, the strength and sensation of the upper and lower extremities, as well as doing the sensory and reflexes if it's required in the face as well. And to rule in or rule out lesions of nervous system peripherally and or centrally. And again, the uh, diagnosis should not only based on one uh, condition, and the patient with the whiplash could suffer from multiple scenarios and different location peripherally, or it could be a mixture of peripheral or central lesions. There are different types of imaging tests can be done. There are three of those that this website uh, offer, but there are more options available for different reasons. If the clinician is trying to find something different with the patient, and but X-rays, it is always a good way to start, and it is fast, it's cheap, and it doesn't take much of space, and many offices they have X-rays, and to see the fractures and alignments of the joints, and that would be a good start for a clinician to start that. Not necessarily you need to get it the first day, and you always can send it to imaging center and get the X-rays done. In a few days, and you get the results from the radiologist, and that gives you some idea where to go after that. If it is the a bigger case in the whiplash and the patient suffering more severely, and they especially when the patient is being referred to ER, CT scan, it is also being used. It has a deeper understanding of the damage and extent of the damage than the X-rays do, and therefore it is recommended at the emergency rooms. But neither X-rays nor CT would provide us with the detail of the soft tissue as MRI does, and therefore the MRI is the technique that clinicians they prefer to have to show the soft tissue damage, like the disc, the spinal cord, as well as the brain. It takes a little bit longer time. It is a little bit more expensive, possibly, and therefore it is not something that can be done right away. But it is a very good test to do for more detailed understanding and study of the soft tissue damage.